Sprains and strains affect the muscles, nerves, tendons, ligaments, joints, cartilage, and spinal discs. They can develop gradually over time or can result from an instantaneous event, such as a slip and fall. Examples of strains, sprains include shoulder muscle strain, low back pain, elbow tendonitis, and carpal tunnel syndrome. In all four cases, these are examples of sprains or strains that gradually develop over time. If you think you may be developing a sprain or strain, it is important to be aware of the following signs and symptoms. Pain or discomfort around a joint that does not subside with time away from the activity. A change in the amount of movement you can perform, or otherwise referred to as restricted range of movement. Loss of strength, tingling, or even numbness. If you are experiencing any of these symptoms, report them to your supervisor early, so someone can look at your work tasks and provide some suggestions to minimize your risk of developing a sprain or strain. Strains or sprains can develop gradually over time. The typical progression of a strain or sprain can be broken into 3 stages. The first stage is often characterized by discomfort. Individuals typically report that they have discomfort around the joint, but it often improves when away from the work activity. If you can address how you are performing your task and change how you do your task, usually symptoms are reversible and individuals see improvement quickly. The second stage is also characterized by discomfort, but individuals often report that the symptoms come on quicker when performing the task and last longer after they have finished the activity. Stage 2 is also characterized by reports of difficulty performing the task efficiently. Again, in Stage 2, if one changes the way in which they perform the task, and if the primary risk factors are addressed, symptoms will often reduce with conservative medical treatment. Stage 3 is characterized by the symptoms always being present both at home and at work. In some cases, individuals will report that they have difficulty sleeping due to the pain or discomfort that is experienced. If symptoms are left untreated, or if your activity has not been modified, recovery is often very poor. So how common are strains and sprains? Strains and sprains represent 25 to 30% of all lost time claims. Unfortunately, that does not give us the complete picture of the impact of sprains and strains. In many cases, the injury does not become a lost time claim, but still impacts the individual and how they perform their job tasks, resulting in a modification of the task or change in job duty. The areas most affected by strains and sprains are the lower back, shoulder and arms, primarily the elbow and wrist.